Vice President Harris has explicitly endorsed Medicare for All, a plan which calls for the elimination of private health insurance. This would prevent over half of America from keeping the plans they have now and that they overwhelmingly prefer. A single-payer system would mark the end of ERISA as we know it and cost taxpayers an estimated $32 trillion. Worse, her plan provides taxpayer-funded health care for illegal immigrants. If the government has any legitimate responsibility in health care, it should at least be to benefit its own citizens. Before I close, I want to take a moment to play a video from the Washington Post that highlights just how real this threat to ERISA is.
I intend to co-sponsor the Medicaid for All bill. And because it's just the right thing to do. I'm proud to co-sponsor it. It is about saying that this is about a right, not about a privilege for a few. You don't have to go through the process of going through an insurance company. Let's eliminate all of that.
Medicare for All would effectively eliminate private insurance. It would essentially phase out private insurance companies
as the main source, but there would still be supplemental. There'd still be access to supplemental. Okay. It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I support Medicare for All. It is my preferred
as a
policy.
principle, you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Well, because the bill gets rid of private insurance for everything that
it doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all.
Mr. Chairman, point of order, please.
Who here would abolish their private health insurance in favor of a government-run plan? All right.
Do you believe that private insurance should be eliminated in this country?
No.
You don't?
No, I do not.
But you raised your hand last night.
But the question was, would you give up your private insurance for that option? And I said yes. My plan will separate your health care
Mr.
from your
Chairman, point of
employer.
order, please.
Meaning your employer will no longer
Pardon?
dictate the kind of health care you receive. Under my plan of Medicare for All, private insurance companies will be able to provide coverage if they play by our rules.
Thank you to our staff. It's interesting, we just had the Vice President in her own words without any commentary, and for some reason, some members didn't want anybody to hear that. It's very interesting.
Okay.
She says...
Point of order, please.
A gentleman's not recognized. She says under my plan of Medicare for All, private insurance companies will be able to provide coverage if they play by our rules. Although she tries to moderate and disguise her position by acting like private insurance companies can keep functioning as normal, does anyone really think they will get better health care when they're playing by Kamala Harris's rules? The Democrat plan is to make private health care unaffordable and ultimately non-existent. One way to do this is to provide artificially and temporarily lower cost government-provided health care to drive private providers out of the market. But everything the government does ultimately costs more, especially with the initial cost of the exploding debt that causes higher taxes and higher inflation. Every government expenditure either causes higher taxes, higher inflation, or debt exploding for the taxpayer. At a time when many Americans are living paycheck to paycheck and personal savings rates are near historic lows, rising health care costs are driven by government interventions are unmanageable.